Excellent. Thank you, Nick, and thank you everyone for coming to spend the next 5 to 6 hours talking about ethics today. So it's going to be a very interesting day. But oh.
There'll be a lapel mic on the desk there.
Oh, is that one there? Nope.
Yeah, that's it. Oh, that's this one.
Maybe I'll move it closer. I might have to move in. How's that? Okay, I'll start again. Can you hear me now? Excellent. No? How about now? There's no lapel mic here at all. Yeah. Tell her someone to come and help.
Sounds fine to me.
Ah, okay.
My voice is way up. Doesn't get any louder than that. You talking?
Testing 1, 2, 3.
Yeah,
Work straight away. Excellent. Okay, how's that? No, I can hear myself. Good. I always seem to get the difficulties being first up, so I test it all for Nick, really. So thank you everyone for coming to join us today for our ethics presentation. As Nick said, I'm Rob McHawk. I'm the manager of the ethics team at the Ministry of Health. My background is I'm a registered nurse by training, and the majority of my clinical career has been here in Auckland, mainly in perioperative environments, working both in management, research and quality, so it's great to see some familiar faces here today. So my presentation is looking at how we're going to deal with the NEAC standards in terms of our operational focus. So the name of today's session is the Modernisation of the Ministry of Health Operational Ethics and Protected Quality Assurance Activity Systems, which we're abbreviating it down to the Modernisation of Ethics Project. So this presentation will have 3 components to it. First of all, I'll introduce the Secretariat that work in ethics and the work that we do. I'll go through the Modernisation of Ethics project, and then I'll go into some detail to discuss how the HDEC are implementing the new NEAC standards. So the Ethics Secretariat at the Ministry of Health, who are we and what we do? So in late 2017, the operational and policy components of ethics were separate groups, and they merged together to form one group, the Ethics Secretariat. And soon after that, we realigned all the positions to make sure that there was a clear career progression for anyone interested in ethics, from administrator right through to Nick and my level. Currently in the team, I have 13 positions that report through to me, and 65 committee members that indirectly report through to me. So the Minister of Health appoints these members through a complex appointment process, and I manage the operational day-to-day management once they're appointed. So we have 7 ethics committees all up across our team. Now the ethics team sits in the Quality Assurance and Safety group, along with Radiation Safety and Health Cert. So we're sort of the regulators of the health system. And that group sits within the Health System Improvement and Innovation Directorate, or HSII, and that group was formed in 2018, and that's led by our Deputy Director General, Kerry-Anna Brooking. So we provide Secretariat support and advice to 5 operational ethics committees. So we've got Northern A and Northern B, which you probably are familiar with, the HDECs here in Auckland. We've got the Central HDEC in Wellington and the Southern HDEC down in Christchurch. We also provide support to the Ethics Committees on Assisted Reproductive Technology, which is ACART, and their primary focus is dealing with applications specifically to reproductive technology. In particular, surrogacy is one issue that they do manage a lot. We also provide secretariat support to policy-making ethics committees, and that is the National Ethics Advisory Committee, or NEAC, who we're here today, the Advisory Committee on Assisted Reproductive Technology, or ACART, and we'll be establishing a new group, which we're meeting very shortly, which will look into gene editing and the relationship with gene editing in health and the way forward for New Zealand. So that group is just about to get off the ground. As you can see, we like to abbreviate everything down to 4 letters. It helps us communicate. So we know who we are, and when I'm asked to actually say it out in full, it's like, give me a moment, I'll have to get back to you. We also provide assistance to the Protected Quality Assurance Activities process, or the PQAAA, and this process is under the Health Practitioner Assurances Act 2003, and those that deal with quality may be familiar with this provision under the Act, where the Minister protects certain activities such as independent college registrar training and DHB M&Ms, so they apply to the Minister to have it protected. So we assist with some of that work. We also provide ethics advice to the Ministry of Health, so we do provide a ethics lens to a lot of policy that goes out. We provide independent advice to the Minister of Health, other government agencies, you guys as researchers, as well as participants of research. So often we will get complaints about dodgy activity that may be going around, and usually they end up on my desk first to investigate. And we're also looking into a little bit more into DHB clinical ethics and how that might shape up in the future. So this is just looking at the volume of reviews just for the HDEC, and this is total applications received, so expedited and full reviews. And as you can see, in the first half of last year, applications did drop off a little bit, and we did have to cancel 2 meetings due to not enough applications. But in the last 2 months of 2019, we did have a peak just before Christmas. I think that may be because people knew that the NEAC standards were coming and they just wanted to get their applications in. But it certainly made life interesting when we came back to work and opened the HDEC on the 16th of January this year. So we do let our HDEC members have a little bit of a holiday. So since we've opened, we have hit the floor running, trying to do a catch-up on our applications that were submitted in December in particular, as well as 5 days training for Secretariat and HDEC members, and also the development of the roadshow. So you may have noticed that our response times may have been a little poorer than usual, but we do thank you for your patience, and hopefully once the roadshow is completed, we'll be back up to speed. So just looking at our total applications received since 2015, so there's a drop of 22 applications from last year, but even though there's been a slight drop, there is a significant increase in the ethical issues facing our ethics committees, and that's been noticeable in my short time on the team. 2019 was still the second busiest year for the HDEC. Right, now onto the modernisation of ethics project and what that will look like, and will be coming this year on our work program. So the drivers for this project, so there is going to be rapid growth in health research and clinical trials, which can be attributed to the New Zealand Health Research Strategy, which I'm sure you're all aware of. And the current government supports this strategy, and it's currently in its implementation phase. We're also in the review of our New Zealand therapeutic products regime, so many of you may have given submissions to the proposed bill late last year, and we're wanting to be prepared for this potential impact because ethics will be a requirement as part of this regime. Of course, there's the new NEAC standards, our IT system, we do hear the feedback, and also our other committees that fall within our team are all paper-based and very difficult to do any reporting on. So we really do need them to join the electronic age. Like anything we have to in government, every time you come up with a project, you've got to link it to a strategy. And ours fits quite nicely into the health research strategy. So this strategy commits to investment and strengthening health research in New Zealand, reducing inequity and improving health outcomes for all. Now there's two strategic priority points that this project will link to. The first one is having investment in excellent quality research systems and being more customer friendly. The second one is actually improving our relationships with the sector, so we're all communicating and on the same page. And Nick will go into a bit more detail with the research strategy later on in his talks. So there's three main project key objectives. We want to develop and implement new standard operating procedures for the HDEC. We want to build, implement and operate a new IT system where there's a new application form that can be tailored to the type of research that you're doing. And we'll be doing this for both the HDEC and SCOT. And we also want to refresh the committee terms of reference because it's been a long time coming and they haven't been reviewed for quite some time. So I'll go into each of these projects in a little bit more detail. The first one is the standard operating procedures, and we'll be doing a formal review of our current SOPs. We want to assess what works and what doesn't. We want to identify what the gaps are, especially looking at the feedback from the 2012 consultation. We want to assess future possibilities. We're looking overseas, seeing how other countries handle ethical review. We want to look at our scope of HDEC review. Is it right? Does it need refining? Does it need broadening? And we also want to look at our current processes for both the Secretariat and HDEC to include how we handle decision challenges, how we handle complaints, how we handle our research peer review process, meeting agenda preparation and procedures. We also want to make sure that we're in line with the NEAC standards. And to do this, we'll be using working groups, HDEC and sector surveys, as well as a targeted consult. And we'll present our recommendations to the Minister. The IT system, we've heard the feedback. We don't like it either. It's a system that is targeted towards clinical trials, and you may be aware it's made up of three portals. So there's the online portal that the researchers use, there's the member portal that the HDEC committee members use, and both of those feed into the RED database, which is what the Secretariat uses. The general usability of RED is very limited across the board for all parties. We do get feedback of the length of the application forms and its relevance. However, any changes to the system is extremely costly. Just to give an example, just to do a simple change on our screen for the Secretariat was in excess of 17,000. So any changes in an application form would be between 3,000 and 4,000 per change. So we're all in the wrong job. The new NEAC standards and the standard operating procedures that we implement will mean that the application form and our processes, the way that we handle our applications will need to change. Also of important to note is that our current system has very limited reporting. So we can only report on 15 categories of the application form, so of what you as researchers put in. So if that information is incorrect or changes as a result of your committee meeting, that doesn't change, so we're always going to be reporting on old information, so we don't actually have updated information at any one time. So we're going to be looking for a system that has a modern interface, that is simple and very intuitive to use. We want the application questions to be tailored to the type of research that you're actually doing and the level of risk, and Nick will go into talking about risk shortly. We want notifications and application statuses just to be automatic without having an administrator actually having to remember to go in and push a button or write a letter as that they have to currently do. We want you to have the ability to have improved form sharing, so whether that be read-only or complete full access, and that is within your research team, your sponsors and your localities. We want transferring and duplication of projects to be simpler than it is. We still like the use of electronic signatures because that's the way forward and it does save time running around the organisation to get signatures. And we also want an easier method of looking at the documents that you're attaching and how it relates to the application form. So at the moment, some applications have in excess of 60 to 80 attachments, and sometimes the committee members just don't see where they actually fit into your application and don't know if we should be looking at them or not. And again, we want a complete electronic process. For the HDEC members and for the Secretariat, it's pretty much the same. We want to be able to use a system that's not clunky. We want a nice, easier interface to be able to communicate with our stakeholders. We want to have increased transparency, both at our end, the committee end, and at your end as the researchers. We want a consolidated work process, so there's lots of duplications in our work processes as a result of the SOPs and the IT system. The aim is to improve our timeliness, and it's hoping with a better system that our timeliness will improve. Ultimately, what we do want is we want to have flexibility in changing the system ourselves. So we want to, if we get feedback that a question is not quite worded right, we want to be able to make that change at the ministry without going to a third party, spending a lot of money and spending a lot of time waiting for it to happen. And we also want a better system reporting. We want to be able to report on everything that you put into the system for our stakeholders and of course the minister. The third phase of the project is in terms of reference review. We want to make sure that we've got the right membership categories on our committees, the right number of members. Do we need to increase them to 10, to 12? Do we need to increase the number of our committees? Do we need to introduce new committees? We want to look at our workload of our current HDEC members and what they're actually going through at the moment. And aside to this is that we also be leading a review of the fees that the HDEC members receive and making sure it's more equitable across the board. We also want to look at the committee education requirements. What requirements should a committee member have, whether it be annually, how many hours training do they need a year? So we need to make sure that that's clearly explained. And to do this, we'll be doing a committee member survey as part of this process, which is almost complete. So this project has 3 levels of governance. The governance group is made of senior managers from the Ministry of Health, that's the first group. The second group is the project team, and they'll be made up of mainly ministry staff from the different teams across the group. So across ethics, our appointments team, our PQAAA and Scott. And then we'll have an advisory group, and this will be made up of different committee members from our ethics committees, representatives from the HRC, DHB research officers and uni officers, and because of the ECART component involved, fertility clinic agencies will also be involved. So we're hoping that by this time next year, ethics will be in a different space. We're hoping for the new technology and the application form to go live on the 1st of July of this year, and the SOPs to be implemented towards the end of this year. So we've got a lot of work to do, but we're never afraid of a challenge. So it's really important to have your say. The changes that we make will affect the way in which you put forward your applications for a review. We want to work alongside you from the start of your project right through to the finish. So it's really important that you give us the feedback about the way that we're operating and how you could see it happening in the future. So there are a number of ways to be involved. You can respond to any of the surveys that we send out. So at the completion of the roadshow, we will be sending out a survey to all of the participants. There'll be opportunities to be invited onto our advisory group, and if any of you out there like breaking IT systems, I want to hear from you because we'll need to have some testers of our new IT system to see if you can break it. And participate in any consultations that we may hold towards the end of the year and attend any of our training. Of course, all the suggestions that come forward we can't implement because I only have a small amount of money. But anything that we do need to put on future work programs, we can look at putting it on the HDEC, NEAC or on the ministry work program going forward. So the final part of my presentation is just briefly looking at the HDEC implementation of the new standards. So as you're all aware, you got a Christmas present, and so did we. of a large document of the new national ethical standards, which came into effect in last week of the ministry year on the 19th of December. Of course, the HDEC system is continuous, and even though we had a holiday, we were still getting applications and amendments through most days during that break. And we've also had a number of applications that are in provisional approval status. So it is very hard to actually shut the HDEC down and say, this is the line in the sand. So there are going to be, or maybe, some projects that are in a provisional approval status that could be affected by the change in the standards. And if this is the case, the HDEC and the Secretariat will work with the researchers to minimise the effect and to work our way through it. For current research that was approved in the 2012 guidelines, you now must be applying the new standards. And as a result of that, you may come across some ethical issues that you may wish to let us know about, and we'll work through those with you over the coming months. It is the coordinating investigators' overall responsibility for the ethics of their project, and they also have the primary responsibility for addressing any ethical concerns that may arise during their project. So as Nick's mentioned, we've done our Secretariat training. We've also done our HDEC members training as well. And our HDEC members will also receive ongoing training, mainly before their meetings as required, based on the applications that have been reviewed and any stumbling blocks that the chairs in particular have come across in their reviews will come up for discussion. We do regular updates and comms on our HDEC webpage and online forums, and we'll be using email a little bit more. We've done our roadshows in Christchurch and Dunedin, and we've got Wellington later on this week. So in total, there's been about 500 registered attendees. We'll be recording today's roadshow, and our slides will be available in late February, early March. So if you're aware of colleagues that weren't able to attend today, please direct them to the NEAC webpage, and everything will be up there shortly. If you do have any questions after today related to the standards, please feel free to contact us either via our 0800 number or via our email at HDECs@health.govt.nz, and the emails in particular will be answered by an advisor. We'll also have guidance on our webpage, as well as all our templates, and everything will also be updated to reflect the new changes.